In this presentation, we will cover how you can extend the use of your N95 mask without compromising protection against TB infection. Due to the COVID-19 pandemic, there are an unprecedented global use of personal protective equipment, and this has had a huge impact on the availability of N95 masks. The N95 mask is a key infection control measure for healthcare workers in caring for patients with TB, especially the drug-resistant strains. It's an essential part of our ability to provide care at our facilities. We need to ensure that we use our N95 masks as efficiently as possible with minimum wastage. To do this, we are proposing extended and limited reuse of the N95 masks. But is this safe to do so? The manufacturers of N95 masks advises single use, but as far back as 2004, the concept had been challenged by clinicians and tests were carried out to determine the safety of reuse. The testing has shown that the filter of the mask is still to be effective after several days of extended use. The CDC has therefore recommended the extended use of N95 masks since 2006. Based on this evidence, many South African hospitals, for example Tygerberg Hospital, recommends the extended or limited reuse of the N95 mask. This recommendation has also been reiterated in the recent National Department of Health COVID-19 Infection and Prevention Control Guidelines, which state that the following regarding the extended use of N95 masks. For up to 1 week for the same healthcare worker, unless respiratory integrity or leak-proof seal is compromised. In practice, it means that the extended use of N95 masks is safe, but with very specific provisos. Firstly, safe use for our normal TB care. To be able to extend the use of your N95 mask but not compromise its safety, it is important to adhere to the following guidelines. Firstly, the N95 mask can be reused or even used more than 1 day if there is a no visible contamination on the mask, so it mustn't be damp from sweat or splashes or damaged in any way. B, that mask must fit and seal well, so the straps must not be compromised. And C, your breathing is not impaired when using the mask. When you want to store the mask in between use, please do it responsibly. Put it in a brown paper bag or a small cardboard box with your name on it. Don't use it in the home or in the community due to possible risk of contamination. And always remember, very important, good hand hygiene when taking off and putting on the masks. Some masks are more robust and can last for a few days, and some may only last 1 or 2. Please only reuse masks that are intact. These recommendations are for normal routine TB care, but it changes slightly in a quarantine ward setting where you are nursing a patient who might have COVID-19 infection. If someone has COVID-19, there's a risk that the outside of the N95 mask can become contaminated with the virus. You therefore cannot reuse a mask that might have been contaminated. But even in these wards, N95 can be reused under the following strict circumstances. So firstly, if you're in the ward and you're performing non-aerolizing procedures around the patient, so for example, just bringing the medication or food or taking a history, and the patient is wearing a surgical mask when you are within that 1.5 meter quarantine area. If the patient is wearing a mask and you're doing routine procedures, then there's no risk of the N95 mask becoming contaminated with possible virus. Another way of protecting the N95 mask is wearing a visor that covers the whole face. When testing for COVID-19, we also have to use N95 masks, and there is obviously also a risk of contamination. You can use the same N95 mask if you're testing several persons in a row, but after you've completed with that group of people, you'll have to discard it at the end of that session, unless the mask has also been protected by a full face visor. COVID-19 is having a massive impact on the provision of N95 masks, which are so essential to our work as clinicians in a TB hospital. Please help us use our N95 masks sparingly and safely. Thank you, stay well and keep safe.